Good afternoon, Chair Krupp, Vice Chair Chosen, Vice Chair Whelan, and committee members. For the record, my name is Aimee Kotek Wilson, and I'm here today to talk to you about House Bill 2467, a bill that would greatly improve the care that Oregon's mental health practitioners are able to provide for our most vulnerable. First, I want to thank NAMI for their incredible work for those living with mental illness and for taking the mantle of this critical issue. I know that their work will save lives. I am testifying here today as a former practitioner who served highly acute, vulnerable populations, specifically individuals living with severe mental illness. I know firsthand how this bill, essential this bill is to our ability to provide care to Oregonians. In my role as a practitioner, I was responsible for assessing clients in critical need of care to determine if they met criteria for civil commitment. I have sat with people in nearly every emergency room in Portland in some of the most difficult moments of their lives. In those same moments, it was my job to help navigate complex legal and medical systems for my clients, provide comfort and protection, and sometimes advocate for their need for involuntary care where I believed it was merited based on my training. Too many times I came face to face with the reality that despite good intentions, Oregon's current laws pose a real threat to the health and safety of patients in urgent need. Civil commitment is a serious thing, not to be taken lightly. But at times, it is the only intervention that we have to keep people safe and provide the care that they need. Simply put, it saves lives. It is a necessary medical intervention, not a punishment. When a person in a crisis doesn't receive the care that they require, it often ends in trauma, catastrophe, and even crime. Being able to deliver this care protects people at the most vulnerable moments in their life and allows patients to stabilize when their ability to make personal medical decisions are compromised by the level of acuity they are experiencing. It in turn protects everyone in our communities. Civil commitment is an indispensable intervention that is not being used effectively. In the emergency rooms and other spaces where I worked with highly acute clients, people who were vulnerable and suffering, I watched our system fail. I saw the consequences on their faces, their bodies. I heard it in their voices, sometimes shaken and other times numb. Through my time in the field, I learned that Oregon is missing the opportunity to provide the care that people need, causing incredible suffering and the exhausting of public resources in the process. Today, you're going to hear incredibly important stories of people whose personal lives and health have been impacted by access to involuntary treatment. They are real, heartbreaking consequences and examples of harm made unavoidable by the system that we currently have. I have seen patients lose their housing, access to critical medical care, relationships with their loved ones, their independence, and progress that they have worked so hard for, all because the criteria failed to acknowledge their acute need for care. I have known patients who underwent emergency surgery that could have been avoided by earlier appropriate medical interventions, or slowly deteriorate from self-inflicted dehydration until they finally met current criteria. If I had been working with any of these clients in another state, 37 states, I could have intervened before it got to that point. Being unable to provide care to someone until they are so dangerously close to irreversible harm is one of the more difficult things I have ever done. This causes moral injury to healthcare and law enforcement professionals. Practitioners in Oregon are having this experience every single day. And worse, people are suffering from the circumstances that we have the power to prevent. This committee has the opportunity to improve this with this bill. Right now, the system is set up so even when it's crystal clear to a practitioner that a client is a danger to themselves, and it's clear where they're headed, and that they're on the precipice of irreversible harm, we often still can't intervene. Cyclical severe decompensation worsens a person's overall prognosis and can take years off their life. This deficit of care not only impacts the quality of care people have, it shortens how long they live. While I'm offering this testimony primarily through my perspective as a professional, it's also been informed by my experience as Oregon's First Lady. On the One Oregon listening tour during the governor's first year in office and during tribal visits in her second, I had the privilege of traveling to every corner of the state. After meeting with over 50 mental health professionals and countless Oregonians whose loved ones had been affected by struggles with mental illness, when I spoke with them, the relief that I understood their plight was palpable. And after the fourth or fifth time a family member pulled me aside to share their personal story, it became clear that I must elevate their voices. For me, when someone is brave enough to share their story, it comes with an obligation to pass it on, especially when the sharing of these stories can help make an urgently needed change. The bottom line is this: we can often see when a patient is about to take a devastating fall. Our job as practitioners and as a community is to do what we can to make sure we catch them before they fall, instead of having to pick up the pieces afterwards. Right now, our laws are preventing us from doing that in far too many cases. It's unnecessary and it's cruel. House Bill 2467 will help change that. I urge your support, and I am so grateful to this committee for taking on this important issue. Thank you.
Thank you so much.